the biggest challenge that you face in your career as a professional physical therapist professionally and as a clinical director on the business side of things? And how did you deal with them?
I think, to be honest, Mariana, one of the most challenging has been of late. So our clinic was hit by the tornadoes in Nashville in March, and it sustained enough damage that we aren't allowed to go back in that building. And then we weren't really allowed even to go back for a while, just to get your personal effects, just to get your jacket, your cup, things that made it home. And so you went from this bustling clinic working with people that you just love on a Tuesday, and Wednesday, you don't work with them anymore. We are fortunate enough to still have jobs, but we've kind of been spread out among different clinics. So you don't get to see your work family anymore. And that's been very challenging. So we now have weekly, quote unquote, staff meetings at my house to still see each other. So I think just dealing with that is just to continue to develop that sense of team. And just because you don't see each other every day, you can still be together in some way every day. I also think just healthcare in general has changed so drastically since I first started. Like way back in the day, there really weren't any visit limits. You could see people for a long time. If there were caps, they were so high, you never reached that. Your documentation was literally 4 handwritten lines, subjective, what the patient said, objective, C-flow sheet, assessment, and now there's so many more things.
That's the dream.
I know. And so now there's just so many more things. And I remember when they first started to have like visit limits, I remember as just this wee young baby, I'd been a PT like 4 or 5 years, just on the phone with a private insurance company. I'll never forget this. It was a patient. She had a bilateral carpal tunnel release, worked in data entry. She couldn't even brush her hair. And they wanted to stop paying for PT. And I remember on that phone for like 30, 45 minutes with somebody, I'm just begging for her to get more visits. And that's when I realized, like, sometimes my voice isn't heard, that my job is to stand up for my patient and be their advocate. And sometimes no matter how hard I try, it doesn't always work. And that was frustrating. So then I had to figure out a different way to be their advocate, a different way to help them. And that was to empower them. Just to empower your patient to ask the question, empower them to know what's going on, have those conversations about visit limits day one. And even though that seems harsh, like that's the reality that we're in right now. As time went on, too, marketing became the expectation that wasn't taught in school. You didn't talk about that. Nobody gave you this skill set. There's not like really a CE, to go about marketing. It's just like, we expect you to do this, go. So that was hard, because I did not like it. So I had to figure out a way again to make it my own. And it was very important for me, for my clinic to be viewed as a resource in the community. So if that means you come for PT, great. If that means you come in and ask me a question about something and don't get PT, great. I want you to be better, faster, stronger. And if that means you get PT, okay. And if not, that's okay too. So the only way I knew to do that was to learn my community, to learn what resources are around me, massage therapists, Pilates instructors, acupuncturists, gyms, personal trainers, just know all those things. And then by doing that, like, it creates your own little network for direct access. And you're not even trying, you're just trying to know people, so you can help your patient when they're finished. So that was probably another real hard thing, is learning how to market.
Yeah, I imagine, because nobody talks about that when you're in college studying, and you just have to go to the world and figure it out. And I think that's very hard for us on this healthy part of things, because we have no idea about any of that. So the advice you would give is just try to reach out to the community and spread the word.
That worked in East Nashville. That worked in this community. Others, it may not. You may be better off in other places getting to know referral sources more, and getting to know referral coordinators more. But East Nashville is very much a small city and a big city. So that worked well here. I think it also depends on the individual clinician's comfort, to be honest. Because if you're calling on people that you're uncomfortable or nervous talking to, they can pick up on that. So I guess my advice would be to make it yours, market in a way that you're comfortable with, that you can own, and that you feel that you can learn and grow in as well.
And how about the direct access that we know it's hard to get them? So what do you think that works best on that scenario to get that patients?
I think, again, by reaching out to the community, a lot of the programs that we started to offer at East Nashville came from the direct access patients, because they would come to us and say, hey, do you offer cupping? Do you offer dry needling? Do you offer? So it was very much driven, and that part of being a resource with the community is to provide what they want. It does no good to be a bakery that sells only chocolate chip cookies if everybody wants sugar, So, I mean, you have to provide them with what they need. So that's how a lot of those niche programs developed at the clinic, them asking for it.
Yeah.